Alien nurse examines human patient, then discovers a strange wound she can't explain. Sci-Fi. Part 1. The intake. The humans have a saying I learned in my third week aboard the Caduceus Meridian. No news is good news. I did not understand it at first. On Verath Sol, silence is the language of hunters and prey. Silence means something is watching. Silence means you have not yet been found. But I have come to understand the human version of it. In a medical bay, when the comm channel stays quiet, no one is dying. No one needs you at a run. You can sit at your station with your secondary hands folded in your lap and watch the starfield scroll past the porthole and pretend, for a few minutes, that the universe is not trying to break things. That was the kind of silence I had on the morning I first met him. His name appeared on my intake screen at 6:13 station time, transferred from Deck 7's emergency triage unit after the overnight medic decided the situation was stable enough to wait for the morning shift. The file was thin. Most emergency files are thick with panic, frantic notes typed by people who are scared and trying to sound clinical. His was 4 lines. Patient, Callaway, Emric J. Human male, 34 standard years. Presenting complaint, lacerations right lateral torso, possible internal bruising. Mechanism, reported fall during cargo loading, Deck 7 lower bay. Status ambulatory, vitals within normal human range, requesting full assessment. I read it twice. Then I read the attending medic's addendum, a single line appended at the bottom as if he had nearly forgotten it. Wound presentation unusual, flagged for specialist review. That was the line that made me sit up straighter in my chair. Unusual in a medical addendum means different things in different mouths. In the mouth of Technician Breck, our overnight human medic who had been practicing for 11 years and had the steady hands of someone who had seen most of what the galaxy could do to a body, it did not mean I panicked. It meant I looked at this, and I did not recognize it, and I thought someone with more years and more tools should look too. I pulled the preliminary scan he had attached, a standard handheld resonance pass, the kind you do in triage when you want a quick picture without committing to a full table run. The image quality was what you'd expect at that hour. A little soft, a little hurried, but even through the blur I could see what Breck had seen. There were lacerations, yes, 3 of them running in parallel lines down the right lateral ribcage, just below the lowest floating rib. The spacing was almost too regular, each one approximately 4 centimeters in length, each one at the same depth. Each one following the same diagonal angle, cutting from upper right to lower left at about 40 degrees from horizontal. A fall during cargo loading would not do that. A fall would give you one wound, ragged and chaotic, the kind of thing that happens when a body meets an edge it did not expect. A fall might give you bruising in a scatter pattern, or a single deep cut where you caught a bracket or a handle. A fall would not give you 3 wounds, parallel, measured, deliberate-looking. I flagged the file as active and went to prepare examination room 3. I have been posted aboard the Caduceus Meridian for 14 months now, which is long enough that most of the crew has stopped looking at me with the careful, practiced neutrality people deploy when they are trying very hard not to stare. I am Verath. I am the only Verath on this ship, and possibly the only Verath most of these humans have ever spoken to at length, which means I have spent 14 months being in education, whether I wanted to be one or not. We are not so different from humans in the ways that matter for medicine. 2 arms, 2 legs, bilateral symmetry, a spine, a skull, a heart that pumps blood. My blood runs a different color, a deep blue-green, the color of deep water, and my secondary hands, smaller and more dexterous than my primaries, emerge from just below my shoulder blades on flexible articulated stalks that allow me to operate instruments while my primary hands hold a patient still. My eyes have a second reflective layer, like a cat's, which means I see better in low light, but tend to unsettle people in bright rooms when the light catches wrong. My skin runs a pale silver blue, and my hair, if you can call it that, the humans do, is a darker blue-silver that I keep braided back tightly during shifts, because lucid tends to drift and float in a way that several patients have described as beautiful, and several others have described as unsettling, and I cannot always tell in advance which reaction I am going to get. I have learned to wear my expression carefully. Verath faces are mobile in ways human faces are not, and what reads on my face as focused clinical attention has sometimes been interpreted by humans as predatory intensity. I work to soften the edges. I have been practicing something Breck calls a reassuring smile, and he tells me I am improving, though his voice, when he says it, has a quality I have learned to identify as diplomatic encouragement. Examination room 3 was ready by the time the patient arrived. He walked in under his own power, which was a point in his favor. He was tall for a human male, tall enough that he had to adjust his posture slightly as he came through the doorway, though it didn't look like something he thought about anymore, just an old, unconscious accommodation. He was wearing the standard-issue gray coverall that cargo workers on Deck 7 wear, and his right side was wrapped in the temporary field dressing Breck had applied overnight. A self-adhesive bio-seal strip that would keep the wounds clean and the edges approximated until someone could do a proper look. His hair was dark, cut close on the sides and longer on top, currently in a state of disarray consistent with a night spent on a triage cot. His face had the particular hollowness of someone who had not slept well and was pretending they were fine. There was a bruise beginning to bloom along his jaw, a separate injury from the lacerations or possibly related, and his eyes, when they found me, were an unexpectedly pale gray, the color of certain kinds of stone. He stopped just inside the door and took me in with those gray eyes, and I watched him do the mental recalibration that humans do when they meet me for the first time. A small blink, a slight adjustment of his head, a micro-expression that ran through not what I expected and resolved, in his case, into something I would call careful openness. "Doctor," he started, then glanced at my name placard. "Nurse specialist," I said. "Asara." The doctor prefix is a translation approximation. On Verathsal, the distinction is less about rank and more about specialization. I am a wound assessment specialist with 17 years of practice and additional credentials in xenobiology. For our purposes today, you may call me Asara, or nurse specialist if you prefer formality. He considered this for a moment. "Emric," he said, "or Calloway if you prefer formality." I found myself, surprised is perhaps not the right word, interested. Most patients, in my experience, meet formality with either answering formality or with an attempt at humor that is covering nervousness. He had deflected the formality back at me with a kind of dry precision that suggested he was paying attention. "Emric," I said, "please sit on the examination table." He sat. He moved carefully, the way people move when they are trying to keep something still, managing pain with posture and intention rather than drugs. His right arm he kept close to his body. "The overnight medic gave you an analgesic," I said, checking the file. I told him not to. I looked up from my screen. "You refused pain relief." "I don't like how it makes me think," he said. There was no defensiveness in it, just a statement of preference, offered matter-of-factly, as if refusing pain medication was the sort of thing a reasonable person might do. "Your wound is being held closed by a bio-seal strip," I said. "When I remove it to examine you, the local area will be." "I know," he said. "I've had worse." I set down my scanner and looked at him more directly. It was, I knew, the look that Breck had told me sometimes reads as unsettling. Emric Calloway did not appear unsettled. He met it with the same steady gray gaze he'd brought through the door. "You have had worse lacerations," I said, "or worse injuries in general." "Both," he said, "different occasions." "Your file says this was a fall during cargo loading." Something crossed his face then, something small and carefully managed, there and gone. That's what I told the overnight medic. A silence. I am, as I said, well acquainted with silence. I let it sit. Is that not what happened? I asked, my voice level. It is, he said, technically. I picked up my scanner again and circled around to his right side. I am going to remove the bioseal now. ===. Part 2, the wound. ===. The bioseal came away cleanly, as it was designed to. Beneath it, the 3 lacerations were exactly as they had appeared in Breck's preliminary scan, perhaps even more precise in person than the image had suggested. 3 parallel lines, 4 centimeters each, same depth, same angle. I have examined wounds for 17 years. I have examined wounds made by knives and claws and tools, and the various implements of violence that different species have invented across the recorded galaxy. I have examined wounds made by falls and collisions, and the terrible creative force of industrial accidents. I have a working knowledge of the wound signatures left by approximately 40 species worth of biological appendages, and another 80 species worth of manufactured implements. I did not recognize this. The edges were clean. Not surgically clean, not the kind of clean you get with a laser tool or a precision blade, but cleaner than any mechanical cutting implement I could name, and without the tearing or bruising around the margins that you expect when something has been dragged or pulled through tissue. These wounds had been opened, and then, this is the part that stopped me, the edges had begun to close on their own in a way that did not follow the standard progression of human healing. Human wound healing has a sequence. I know it well. The body plugs the breach, then builds a framework, then begins replacing what was lost. This process takes days, sometimes weeks, and it follows a predictable pattern that you can read like a clock if you know what to look for. These wounds were perhaps 6 to 8 hours old, consistent with the time frame on the report, but the tissue at the edges showed a degree of organized repair that I would expect to see in a wound 2 or 3 days along. Not healed, but healing in the wrong direction. I brought my secondary hands in close, using the fine motion instruments to gently probe the margins. My primary hands I kept still at my sides. Emmerich had gone very quiet. He was watching me with those gray eyes from the corner of his vision, not turning his head, just tracking me with the peripheral attention of someone who was monitoring, without wanting to seem like he was monitoring. "You are healing unusually quickly," I said. "Am?" It was not quite a question. The tissue response at the wound margins is inconsistent with the reported injury time, I said. I kept my voice clinically neutral. This is a skill I have cultivated carefully, because the alternative, letting my voice carry the full weight of my scientific curiosity, tends to alarm patients. I'd like to run a full resonance scan. "Okay. On the table, please, flat on your back." He moved to lie down with the same careful management of his right side. When he was flat, and the table's arm had extended to position the scanner array above him, I ran the calibration sequence and began the full pass. The scanner is a beautiful piece of equipment. It works in layers, first the surface, then the subcutaneous tissue, then deeper, reading density and composition and blood flow and cellular activity, and a dozen other parameters simultaneously, building a picture that is more thorough than any single sense could provide. I watched the image construct itself on my screen in real time, and I watched it, and I kept my face carefully still. There was a wound. There were 3 wounds, visible as bright lines of disrupted tissue running through the right lateral ribs. No internal bleeding, which was good. No cracked ribs, which was also good. The bruising was present but localized, consistent with an impact to the area around the wound site. There was also something else. I almost missed it. It was in the deepest layer of the scan, faint enough that I ran a second pass to confirm. An area of tissue at the base of the wound track, the lowest and deepest point of the central laceration, that showed a cellular activity signature I had never seen before. Not human. I am careful with language. I'm not careless with diagnoses. So let me be precise. The cellular activity at that site was not consistent with any baseline human tissue function I had encountered or studied. It was not a pathology. It did not read as diseased or damaged. It read as different, metabolically distinct. As if, at the very bottom of this wound, the cells were operating according to a different set of instructions than the cells 2 centimeters away. I sat for a long moment with my secondary hands clasped and my primary hands very still on the edge of the console. Then I said, with my most carefully calibrated clinical voice, "Rick, how long have you been aboard the caduceus meridian?" "A beat about 8 months. And before that?" "Various postings." "Do you have a primary physician, a long-term care provider who has your baseline records?" "Another beat, this one slightly longer, not for about 4 years." I turned away from the screen and looked at him. He was staring at the ceiling. His hands were flat on the table at his sides, the deliberate stillness of someone who is choosing not to fidget. "I need to ask you some questions," I said, "and I need you to answer them honestly, because what I am looking at is something I cannot explain with the information I currently have." His jaw tightened slightly, the bruise along it shifted. "What are you looking at?" "I don't know yet," I said. "That's why I'm asking." He turned his head to look at me directly. Those gray eyes had changed quality. There was something behind them now, something careful and evaluating, the look of someone making a decision about how much to say. "What do your questions sound like?" he asked. "They start," I said, "with what actually happened on Deck 7. == Part 3, the history. == He was quiet for a long time after that. I did not press him. I went back to my screen and annotated what I had found in the scan, carefully, in language that was accurate but not alarmist. I pulled up the deeper resonance imaging and rotated it slowly on the display, examining the anomalous tissue from different angles, looking for context I didn't have yet. "Are you going to report this to the ship's medical officer?" he asked finally. "I am required to report anomalous scan findings to the chief medical officer," I said, without looking up. "Dr. Vashit will receive a summary when I close my shift notes. Whether that summary contains specifics depends on whether I have an explanation for what I found." A silence, and if you don't have an explanation, then the summary will reflect that I found something unusual that requires follow-up. I looked at him. "I am not trying to pressure you. I am trying to understand what I am looking at so that I can give you appropriate care and file an accurate report. Those two things are, in this case, the same thing." He looked at the ceiling again. "It wasn't a fall," he said. "I know." He stopped, reconsidered, started again. "There was an argument in the lower bay with a cargo runner from the Alethian Star. His crew had shorted our manifest by almost a full pallet and wasn't acknowledging it, and things got," he paused again, "physical. He had a blade. 3, apparently." Something that was almost dry humor moved across his voice there and gone. I was distracted. "The wound pattern is consistent with a clawed or multi-tipped implement," I said. "Something with 3 points at a fixed spacing. Do you know what he used?" "No, it was fast." His eyes stayed on the ceiling, faster than it should have been. I looked at him. "What does that mean?" "He moved wrong," Emmerich said simply. "The way he moved, it wasn't right, too fast in the wrong ways, like his joints didn't work the way they were supposed to." He exhaled slowly. "I've been in enough fights to have a sense of how bodies move. His body moved like something I haven't seen before." I was very still. "Did you report this?" "I reported that I fell," he said, "because the alternative was explaining that I got cut by someone who moved wrong, and that sounds like concussion talk." It does, I agreed, but it is also consistent with something else. I turned fully toward him. Emric, I need you to tell me if there is anything in your medical history, anything at all, that would explain why the cellular activity at the base of your wound is not reading as standard human biology. He went very still. And then he did something unexpected. He sat up, carefully managing his right side, but with the deliberate intention of someone who has decided to stop lying down and face something. He sat on the edge of the table and looked at me with those gray eyes and said, "How much do you know about the threshold trials?" I blinked, slowly, the way Vereth do when we are genuinely caught off guard. "The colonial preselection program," I said. "From the early settlement era, before the genetic screening protocols were standardized." "Before they were standardized," he said. "Yes." "They were discontinued," I said. 70 years ago, approximately, there were documented complications. There were documented successes, too," he said. "They just weren't documented as loudly." He looked at his hands, his own two-handed human configuration, nothing unusual in the shape of them. "My grandfather was a threshold candidate, second-generation testing cohort." I processed this. I am not slow at processing. On Verathsol, the training for my specialty included significant coursework in human genetic history, because the galaxy is full of humans and humans have been doing interesting things to their own genomes since before they had the vocabulary to describe what they were doing. "The second cohort," I said carefully, included trials of what they called environmental adaptation sequencing. "Yes," which was a broad phrase for a number of different modifications, I said, some of which were heritable. "Yes," including accelerated cellular repair protocols. He met my eyes, among other things. I sat down on the stool beside the examination table, not because I was tired, because this was a conversation that deserved to happen at eye level. "You have never disclosed this," I said. "To a medical professional," he shook his head. "My father didn't know until he was 50. My grandfather kept records, but not the kind you file officially. He paused. He was afraid of what would happen if the program got attention again. A lot of the early candidates were afraid of that." "So your cellular repair signature is unusual because your genetic baseline is non-standard," I said. "A legacy of threshold modifications passed down through your family line." "That's my best guess," he said. "I've never been formally tested. I've never been sure enough to want to be formally tested." I looked at him for a long moment. There was something strange happening in my chest, a Verath physical response to emotional input that I have never found quite the right human word for. The closest approximation is weight, the kind of weight that settles when you understand that someone has been carrying something alone for a very long time. "You did not want to be an anomaly," I said. He laughed, a short, quiet sound. "I spent a lot of years making sure I wasn't." "But you bled in front of an overnight medic last night," I said. "Breck didn't notice anything odd," he said. "Or if he did, he didn't say so." "Breck flagged your wound for specialist review," I said gently. A pause. "Oh." "He is a conscientious medic," I said. "He may have sensed something was different without knowing what he was sensing." I looked at the scan image still rotating on my display, those 3 precise lines, that anomalous cellular glow at the base. "He was right to flag it, but the flag brought you to me." "Is that good or bad?" Emric asked. "I am," I said, "the only person on this ship with the training to identify what I found in your scan as a possible threshold genetic signature rather than a pathology." I let that sit for a moment. "And I am also someone with a strong professional commitment to patient confidentiality." He looked at me, really looked, in the way people sometimes do when they are checking whether someone means what they just said. "Dr. Vashit will receive a report," I said. The report will indicate that you sustained lacerations consistent with a bladed instrument during a physical altercation on Deck 7, that the wounds are healing well, and that your accelerated tissue repair is the result of a documented genetic variant with a confirmed family history that does not require intervention. I looked at him steadily. That last part is conditional on you providing me today with your grandfather's records, whatever he kept. He stared at me. You'd need to see them first. I need to see them to write a report that is accurate, I said. I am not asking you to trust me blindly. I am asking you to trust that I am not interested in making you an anomaly in the ship's medical database without cause. Another silence, different from the others. This one had something in it, something that was either the beginning of a decision or the weight of almost having made one. "They're in my bunk," he said. "Encrypted files, not much. My grandfather was careful about what he wrote down. Bring them when you can. I'll be here until 1800. He nodded once, and then he looked at his hands again, and then he looked at the wound at his side, the 3 parallel lines, still vivid and strange, and he said, quietly, almost to himself, "He moved wrong." "The cargo runner," I said. "Yes," he looked up. "You believe me?" "I have no reason not to," I said. "And I've spent 14 months on a ship full of species, Emric. I know what wrong movement looks like. I know what it looks like when a body is operating on a different set of instructions." I paused. "Which means I know, also, that whatever you fought on Deck 7 may not have been what it appeared to be." The temperature in the room seemed to change, very slightly. The way it does when a conversation moves from the personal to the operational, when something that was contained becomes something larger. "You think he wasn't human," Emric said. "I think," I said carefully, "that the combination of his movement pattern as you've described it, and a weapon capable of producing wounds with this particular spacing and precision, is something worth looking into." I stood. "But that is a different matter from your medical file, and it is a matter for ship security rather than a wound specialist." "If I report it," he said, "the whole story comes out." "Not necessarily," I said. "What you tell security about your own body is your choice. What I tell them is governed by confidentiality protocols." I looked at him. "But I would suggest that if someone on this ship is not what they appear to be, and is willing to use a multi-bladed implement on a cargo worker over a manifest dispute, you would rather have ship security knowing about it sooner than later." He was quiet for a moment. "You're not what I expected," he said. "Patients often say that," I told him. "Please do not leave the ship until I have reviewed your grandfather's files. If the cellular signature is what I think it is, you may need a supplemental analgesic protocol for when the repair sequence accelerates. It can be uncomfortable." He looked at me with something that might, on a human face, have been the beginning of a smile. It was small and a little crooked, and it disappeared quickly, but it was there. "I'll bring the files," he said. "Good." I handed him a new bio-seal for the wound, a longer-lasting one than Breck had used. "And Emric, the altercation on Deck 7, did anyone else see it?" He thought. "One of the cargo loaders. He was at the other end of the bay, might have seen something." "Tell security that," I said. "A witness changes things." He stood, accepting the bio-seal, and began replacing it over the lacerations with the practiced efficiency of someone who had, as he said, done this before. His movements were careful and precise. When he was done, he looked up and found me watching and did not seem bothered by it. "Thank you," he said, simply, without the particular overemphasis people use when they are surprised to be grateful. "It's my job," I said. "It wasn't," he said, "not all of it." He left. I stood in examination room 3 with the scan image still rotating on my display, and I looked at those 3 precise lines, and the anomalous cellular signature at their base, and I thought about men who carry their grandfather's secrets in encrypted files, and cargo runners who move wrong, and wounds that shouldn't heal the way they were healing. Equals equals equals. Part 4, the files. Equals equals equals. He came back at 16:14, which was 46 minutes before my shift ended. I had spent the intervening hours on 3 things: closing out my other cases for the day, reviewing everything in the ship's medical database pertaining to threshold trial genetics, which was not much, because the program had been deliberately underdocumented, but there were references in 3 different xenobiology journals that touched on the edges of what had been done, and thinking, with more attention than was strictly clinical, about Emric Calloway. This last activity I did not formally acknowledge to myself until he walked back through the door of examination room 3, still in his gray coverall, carrying a small data chip in his left hand. He was cleaner than he'd been that morning. He'd had a chance to shower, and his hair, which had been disordered before, had been pushed into something that was not quite orderly but was at least intentional. The bruise along his jaw had deepened to the purple-green stage that meant it was processing correctly. His right arm he still held slightly close to his body, but less carefully than before. "Files," he said, and offered the chip. I took it. Our hands came close but did not touch. I am precise about these things. Not out of aversion. Verath are not touch-averse, and I have spent enough time among humans to lose most of my unfamiliarity with their proximity habits, but because patients and caregivers occupy a particular kind of space, and I am careful about collapsing it before the moment is appropriate. I slotted the chip into the secondary reader and waited. The files were, as he had warned, not much. His grandfather had been thorough in some ways and deliberately vague in others, the practiced vagueness of someone who knew they were making a record and wanted it to be both real and deniable. There were notes in a tight handwritten style that had been scanned in the handwriting belonged to someone who was good at it, who had learned in a time when handwriting mattered. And there were 3 or 4 pages of what appeared to be medical observations written by someone who was not a medical professional, but who was trying very hard to be precise. The relevant section was about halfway through. Cellular repair acceleration confirmed my own with some confidence after the incident with the scaffold. What should have needed stitches was closed in 4 hours. I've been timing things like this for 3 years. The pattern is consistent. Cuts heal fast. Bruises go faster than they should. I've had no significant illness in 11 years since I was 32. I don't know if these things are connected. What I know about the trials, they were giving us sequences from elsewhere. Not invented, sourced. I didn't understand this at the time. I was young and I wanted to be selected, and I didn't ask enough questions. What I understand now, talking to the others who were there, is that we were getting modifications that had been designed somewhere that wasn't here, that had already been tested somewhere that wasn't here, and that what they were doing was adapting them for our biology. Most of the adaptations didn't take. Mine did. The people running the program told me my results were exceptional. I think what they meant was too exceptional to publish. I think what they were afraid of was exactly what happened to Myra Tannant, Cohort 3, when her results became public, and she spent 2 years being studied by people who had no interest in her as a person. So I am writing this down, and I am sealing it, and I am giving it to my son when the time seems right. And if the time never seems right, then this goes with me. What you carry in your cells is yours. Nobody gets to own it. I stopped reading. I looked at the wall for a moment. Then I looked at Emric. He was watching me with an expression that I had learned, over 14 months of working with humans, to identify precisely. It was the expression of someone who had shown you something true and was now waiting to find out whether that had been a mistake. "Sourced," I said. "That word," he agreed. He didn't know from where. No, and the people who could have told him were not people he trusted. He paused. "I've looked. I haven't found anything conclusive." I turned back to the screen. "The cellular repair acceleration. You said it happens with cuts and bruises. Are there other expressions?" He considered. "When I'm sick less long than other people. I recover faster from physical strain. My reaction time," he paused again, "is better than it should be. Better than my training explains." "And the cargo runner on Deck 7 moved in a way you recognized," I said, "because you have moved that way yourself." The silence that followed was a different kind of silence, denser somehow. "I hadn't put it that way," he said quietly, "but yes." I looked at him for a long time. In the reflection of the room's polished equipment, I could see myself, pale silver blue, braid over my shoulder, secondary hands folded carefully at my back, the kind of stillness I had trained into my body over 17 years of practice. And across from me, a human man who was not entirely what baseline documentation said he was. Sourced from elsewhere. In 17 years of xenobiology work, I knew what that meant. I knew what it pointed toward. And I knew, equally, that this was the kind of knowledge that could make someone's life very complicated very quickly if it moved in the wrong direction. "I am going to need to run one additional test," I said, "with your permission." "What kind of test?" "A comparative resonance imaging sequence. Narrow band, keyed to the signature I found in your wound site. If I'm right about what this is, it will show up elsewhere in your tissue not as a wound, not as damage, but as a pattern." I paused. "It will not be painful, but it will be more information than you currently have about yourself, and you should decide if you want it." He looked at me steadily. Those gray eyes, unreadable in the way that eyes become unreadable when someone is in the middle of a decision they can feel the weight of. "What do you think you're going to find?" he asked. "I think," I said carefully, "that your grandfather was adapted with something that was not designed for human bodies, but was compatible with them. I think that compatibility has been stable across 3 generations, and I think that what you fought on Deck 7 may have been carrying a version of the same thing that was not stable." He absorbed this. "Run the test," he said. == Part 5 The pattern. == The narrowband sequence took 40 minutes. I ran it twice, once to establish the pattern, once to confirm. When I had what I needed, I sat down across from Imric Calloway with the image open on the portable display and showed him what I had found. It was beautiful, in the way that things are sometimes beautiful when they are complex and precise, and designed rather than random. The signature ran through him like a second skeleton, not dense or mechanical, nothing that would show on an ordinary scan, but there, laced through the connective tissue and the fine network of vessels and the specialized repair cells at the base of his immune response. A lattice of function that had no corresponding structure in standard human biology. "That's inside me," he said. "That's you," I said, "or part of you. The part that heals fast and reacts fast, and has kept you from getting seriously ill for probably most of your life." He stared at it for a long time. "It's pretty," he said, and he sounded almost surprised. "It is," I agreed. "Is it safe?" 3 generations of express stability suggests yes, I said, "and your health indicators are excellent, but I want to understand the origin better, if I can find a match in the literature." "You're going to look for it." "I already started," I said, "while you were getting the files." He looked at me. The expression was the one I had been watching evolve since he walked through the door that morning, something opening and adjusting and becoming less guarded by degrees, like a room that has been closed up for a long time and is being aired. "Why?" he asked. It was a genuine question, not suspicious, just, "Why are you doing this?" I thought about how to answer it honestly. "Because the wound was interesting," I said, "and because what the wound led to is more interesting, and because," I paused, "in 17 years of practice I have not seen exactly this, and I find in my experience that the cases that are genuinely new are worth understanding fully, not because they are useful, because they are real and real things deserve to be understood." He was quiet for a moment. And the part where you're not reporting my genetic background to the medical database, he said. That is a different reason, I said. That is because your grandfather was right. What you carry in your cells is yours. I am not interested in making you into a specimen. Another silence. You're different from what I expected, he said again. You mentioned that this morning. I'm mentioning it again. He looked at the display, at the lattice of himself glowing on the screen. I never showed anyone those files before. I know, I said. Thank you for trusting me with them. He looked at me. The guard had come down further. I was aware of it the way you are aware of a change in air pressure, not dramatic, not announced, just present. What happens now? He asked. You let me contact ship security anonymously about the cargo runner, I said. You check in with me in 72 hours so I can confirm the wound is healing normally given your repair sequence. And you, I paused. You let me look at the literature. If there's an origin for what's in your biology and I can find it, it might tell us something about what you encountered on Deck 7. And if you find it, then I tell you, I said, and we decide together what to do with it. He looked at me for a long moment, and then he said something I did not expect. Do you want to get a meal? He asked. There's still an hour before the commissary closes. He glanced at the display, at the lattice of himself, and back at me. You just spent a day figuring out what I am. It seems like the least I can do is buy you dinner. I sat with that for a moment. What you are, I thought. What you are is a man who kept his grandfather's secrets for 34 years and walked in this morning and decided, in the span of one conversation, that I was worth trusting with them. What you are is strange in a way that is not frightening. What you are is a question I find I am very interested in continuing. I eat differently from humans, I said. I know, he said. The commissary has options. I looked at him for a moment longer. Then I reached over and closed the display. All right, I said, let me file my shift notes. Epilogue, 72 hours later. He came back on the third day. The wound had healed ahead of schedule, consistent with his grandfather's notes, consistent with the repair signature on the scan. What had looked like it would need another week was clean-edged and closing well, the kind of progress that would have been remarkable in a baseline human patient, and was, in his case, exactly what I had expected. I told him this. He accepted it with the same matter-of-fact quality he seemed to bring to most things. And the literature, he asked. I had found something. Not a match, not yet, but a reference in a 40-year-old xenobiology monograph to a similar cellular architecture observed in a single population in the outer settlements, a population that had reported the same unusual recovery patterns, the same apparent enhancement, the same deep reluctance to have it examined too closely. The monograph had been published in a small academic journal and had never been widely cited. The author had disappeared from academic records about 8 years after publication. I had flagged it, I had made copies, I had started a careful private research file. I did not tell him all of this at once. Some things are better arrived at gradually. I found a thread, I said. I'll need more time to pull on it. He nodded. He looked at his side, at the nearly healed skin, where 3 strange parallel lines had been 72 hours ago. Ship security talked to the cargo runner's captain, he said. The runner himself is gone. The Alethian Star filed a crew change 2 days ago. He's off the manifest. That's fast, I said. Yes, his voice was careful. It is. We looked at each other across the examination table. Between us, a medical file, a genetic legacy, a thread I had found in a dead man's monograph, and a cargo runner who moved wrong and had disappeared before security could look too closely. You're not worried, I said. It was not quite a question. I'm always worried, he said. I'm just used to it. He paused. You. I thought about it honestly. I'm interested, I said. Which, for me, tends to serve the same function. He looked at me. The almost smile appeared again, more settled this time, not quite as quickly gone. Dinner again, he said. I think we have things to talk about. I think we do, I said. Outside the porthole, the stars moved in their long, slow arc, the ship turning through a darkness that was full, as darkness always is, of things that had not yet been found. I reached over and closed the examination file. Some things deserve more than a single appointment. ===. End. ===. Word count, ~9 800 words runtime, minutes at 160 WPM.